Hey, it's Mike Recruiter with Physical Therapy Now. We've had a lot of questions about shoulder pain. How can I avoid shoulder pain? What happens when I lift and I'm getting achiness in the top of my shoulder, the outside of the shoulder? One of the things that we always ask people is, are you strengthening your rotator cuff enough? A lot of people are spending a lot of time doing military presses, upright rows, deltoid raises, but what are they doing for their rotator cuff? Stick around and we'll show you 3 rotator cuff exercises that will help you to remain in the gym and become active. One of the problems that we have with rotator cuff issues is that it precipitates pain in different places. There is referred pain into the shoulder from rotator cuff problems. You cannot push through a rotator cuff problem. It has to be addressed. There's no such thing as no pain, no gain here. So let's take a look at those 3 exercises for your rotator cuff. The first exercise that we're going to take a look at is external rotation of the shoulder, targeting infraspinatus and teres minor. These 2 rotator cuff muscles are very important because with the strengthening of the rotator cuff, the ball of the humerus gets put into the socket of the glenoid, and the glenoid has a very shallow cup to it. So what we're going to do is we're going to grab onto a TheraBand or some other type of resistance band. We're going to keep this to our side, and then we're going to gently pull this apart, keeping the elbow right into your side. There should be no pain when you're doing this. If there is, then don't do this at all, and you have a couple other issues that need to be addressed. Any pain originating out into the lateral side of the shoulder, outside of the shoulder, needs to be addressed. Pain is a symptom that something's going on that's not right. It has to be addressed with very specific means. Doing this will not help that, and you could actually give us a call at our office and we can take a look at that for you. The second exercise that I'd like to show you is for teres minor specifically. It's a little bit of a more vulnerable position for the rotator cuff, but excellent. So we're going to take the band that's tied to anything, and we're going to keep our elbow out 90 degrees. We're then going to turn this straight upward, and that's actually the exercise that we're looking to do, or the strengthening maneuver we're looking to do. Keeping it at 90 degrees at the elbow and turning upward. That's it. That's number 2. The next exercise that we're going to take a look at is for subscapularis. This is another rotator cuff muscle that's very important. We're going to have the band tied again to a pole. Elbow is going to be inside, and then we're rotating this straight in toward our belly button. And you can pick the sets and reps depending upon your activity level. If you are in sport, you're going to want to increase this and also different resistance. You're also going to want more endurance. If you are someone who's just maybe experiencing weakness, then it's going to be a different story with your sets and reps. That'll depend on your activity level. Will also depend on if you're coming back from injury or not. All right, now I'm going to give you a bonus exercise for your rotator cuff. The 4th rotator cuff muscle, which is actually the one that's most torn, called the Supraspinatus. We're going to try and strengthen that right now. So I'm going to have like another TheraBand here. I'm going to step on this TheraBand. I'm going to take a step back, step on this TheraBand. My thumb is going to be down. I'm going to hold this band into my hand, and then I'm going to keep my elbow locked, and I'm going to bring this up and slowly lower it down. So this exercise is hitting supraspinatus. The 4th, and this is the bonus exercise that I'm giving you today, the 4th rotator cuff muscle, the one that's most commonly torn. All right, so generally we would do this about 3 sets of 10, 2 sets of 10, and that is your very last rotator cuff muscle for strengthening. Thank you.